brain, the heart, the kidneys,
the liver,
the eyes, the lower limbs, and people end up with complications because this sugar is in high amounts that it shouldn't be. So we have our organ called the pancreas, which removes blood removes sugar. The pancreas produces insulin, which removes sugar from the blood and takes it to the cells where it is needed. Because in the cells, that's where you use the sugar to get energy.
Yes.
You don't need it, a lot of it in the blood. So our pancreas, that is its role. However, for someone to have diabetes, there are many things that are happening to their body to make this sugar not regulated. And many organs participate in regulating blood sugar, including the brain, including our liver, including our muscles, including our kidneys. And so all these ones work together to make sure that the blood sugars are within the normal amounts. So, of course, in the background, there is usually a genetic risk. So meaning that people who have a first-degree relative, a father, a mother, a sister and brother, are likely to have diabetes more than those who do not have a first-degree relative. So there is usually in the background a genetic risk. And, of course, the environmental factors, including lifestyle. We are facing an increasing burden of diabetes both globally and in Uganda and in Africa. Now, if you look at the statistics, we are seeing that currently we have over 530 million people living with diabetes.
Here in Uganda?
Globally.
Now,
three quarters of this in the low and middle income countries
where we lie.
And very concerning is that by 2045 the increase in diabetes, in numbers of people living with diabetes, is going to be highest in the African region, in sub-Saharan Africa, compared to other regions, as high as 135% increase in the numbers of people living with diabetes in Africa, compared to 15% in Europe, 16% in Australia and others. So we are going to see a bigger increase in Africa. Now, the current statistics of Uganda, which study was done in 2023, showed that we saw an increase from 600,000 people with diabetes in 2014 to over 1.5 million.
Oh my goodness.
In Uganda.
That was
now,
a very big shift.
This statistic is not representing the entire numbers of people, because 50% of people with diabetes are not even aware. So there are those 50% who are there and they have diabetes and they are not aware. Now, interestingly, this increase is not different in rural and urban settings. So even the rural settings, which was unlike in the past, are also seeing an increase.
Because in the, sorry to cut you short, used to say that the rich people are the ones likely. So the rich people used to live in town, and then maybe the little, I mean, not say poor, but the low income earners used to stay in the village. So we used to relate to that in that perspective.
So that's how it was. But the recent statistics are showing us that even the rural people are having a burden, a big high burden of diabetes. And so it's not about the rich, it's not about the poor, it is about everybody to be involved. And of course, we've seen a change in the lifestyles that we are living. People are no longer physically active, people are eating unhealthy. Even when you went to the rural places, like we've been to some places in the rural places where people are staying, you find that people still live around those town centers where they're eating chapatis and mandazi and what. So people are no longer eating the local foods, which are more healthy, the vegetables and fruits and what. So even in the rural places, people are eating unhealthy. Of course, other factors include increasing obesity. Obesity is a problem. We have seen a double number of increase in obesity in Uganda, and this is one of the epidemics that we are going to really see in the near future. So obesity also contributes to diabetes. Other factors like alcohol use, smoking, high cholesterol levels, so all these ones are contributing to the increase in diabetes. Now, diabetes has types. We have the type 1, we have type 2, we have the gestational diabetes, and also diabetes due to other causes. Now, diabetes type 1 is more common in the younger people, less than 30 years of age. But we also can have those above 30 years with type 1 diabetes. And type 1 diabetes used to also be a problem of the developed world, the whites and those people who are highly developed. But we are seeing also an increase in type 1 in our setting. And type 1 is an autoimmune disease. Autoimmune means that the body forms cells which attack the cells of the pancreas. So they attack themselves. And what is driving this is also part of lifestyle. Now for type 1, what happens is that usually during pregnancy, women are exposed to viral infections. So viral infections make the body produce cells which will eventually fight the beta cells of the pancreas, which produce insulin. So viral infections, other problems include the diet. Unhealthy foods also can contribute to type 1 diabetes. Genetic risk also contributes to type 1 diabetes. Importantly, also, if you do not breastfeed your children in the early, first 6 months of this child is likely to develop type 1 diabetes, because there is an autoimmune process which happens when the children are exposed to the foods, the cereals, the other forms of milk, cow's milk, and others. So not breastfeeding also exposes children to type 1 diabetes. But also importantly is stress. Now, stress during pregnancy for this woman who is carrying the baby, but also stress to this child in the early childhood. So that is why we are encouraging women to take care of the pregnancy. We are encouraging the men to support their wives during pregnancy. We are encouraging the women, the mothers, to take care of these children in the early childhood to prevent type 1 diabetes. So there is also gestational diabetes. This is diabetes where the blood sugars rise during pregnancy. Someone has been normal, then during pregnancy the blood sugars rise. Now, this is partly because of the risk factors we've mentioned, obesity, unhealthy foods, but also the placenta, which is the organ that feeds a baby, is producing many hormones which are going to cause what we call insulin resistance, and this one is going to temporarily cause gestational diabetes. Now, usually immediately after delivery, this mother's blood sugars will go to normal. But 50% of this mother who has had gestational diabetes is going to eventually
have the original diabetes,
type 2 diabetes. 50% within the 10 years period. Yes. Yes. So within the 10-year period, 50% will have type 2 diabetes. So that's why we also want to keep hold of this mother who has had gestational diabetes. And the child who is born to this mother with gestational diabetes is likely to also have diabetes eventually. So we need to educate people about diabetes. We need to educate people about prevention so that we are able to prevent death and complications of diabetes, Mr. Kamara.
Wow, thank you so much, Dr. Susan. You've explained that. Thank you so much, Brian. Brian has brought about the types of diabetes, gestation diabetes mellitus. Can even continue to give us more information. Thank you so much for giving us the infographic. But of course, we want to once again thank you for demystifying the different complexities. And I love the fact that you've told us the shift. The shift was too much now, from 700 to 1 point something million. That's a big number that our viewers should take keen of and should pay attention. You can even go on and explain those to our viewers, because they are now watching those live.
Yes, so this is what we are talking about: type 1 diabetes, type 2 diabetes, and also gestational diabetes. And for type 2 diabetes, by the way, now type 1 diabetes, because they are not going to have insulin completely produced, they live on insulin, and insulin is an injectable form. Yeah, so these are people who are going to live on injections for the rest of their life. Now, type 2 diabetes patients may use oral drugs. The challenge is it is difficult to explain to this type 2 diabetic patient that you can also, by the way, need to be on insulin, depending on the point at which the diagnosis has been made. Now, a study which was done by one of the diabetologists in Uganda, this study found that 32% of those people who are studied, about 500 of the people who are studied, had what they call lean type 2 diabetes. Lean means being small. Now, usually people expect type 2 diabetic patients to be obese. And most of these patients, over 60%, were men. They are small men, small-bodied. They don't have the pot belly. They have type 2 diabetes. Now, interestingly, these people had beta cell dysfunction, meaning that they are not also producing insulin. So meaning that these are patients, they are young men in their 30s, in their 40s, they are type 2 diabetic, but they have to be on insulin. Now, to explain this to a patient sometimes is very difficult for us.
Very hard.
Yes, because they are like, no, I'm not type 2, I'm not type 1.
Type 1.
I'm type 2. How can you give me what? Injections.
How can you give me drugs of different order?
Different, yes. So we have to continue educating people about this. And of course, this is something which is now new to us. We are trying to now do further studies to understand what is happening now. Things have changed from what we knew. Yeah. So we don't look at people's size and say, you are not at risk of diabetes. You're likely to have diabetes even when you don't have this pot belly, even when you're small. Yes.
Wow, thank you so much. We want to bring out the problem. Why do we celebrate this November as the World Diabetes Month, the whole wide, and also bringing out the specific date every 14th November?
Yes.
Why did the world actually come to a conclusion that diabetes should be made aware of?
Yes, so I think, Mr. Kamara, you've had the statistics alarming, and yet the low and middle income countries like Uganda are facing the biggest burden. They are more likely to die. Some statistics were done, for example, comparing type 1 diabetes patients in the low-income countries with those in high-income countries. And they found that averagely, a type 1 diabetic in a low-income country is going to live for 9-10 years. A type 1 diabetic patient in a high-income country is going to live for 70 years, like any other person, over 70 years. So we are seeing a big burden of diabetes that is causing consequences. And yet, people continue not to be aware about diabetes. Yeah, so this comes in to create awareness for people to hear that diabetes is with us. Diabetes is a problem. We need to come together and understand what diabetes is doing to us. Now, diabetes causes harmful complications which are too bad for people. Go through a lot of problems because of the complications of diabetes.
We are going for a short quick break, but when we return, shall talk about the complications, then prevention strategies, so that we shall also start receiving your phone calls and reading your messages in case you've engaged in our discussion. See you shortly.
TV, lighting your soul. Pastor Pasteri Music Center, located along Chagwe Road on Serwaniko Music Plaza, shop number B4, in Justine Arcade, shop number G73, next to Chiseka Market, brings you all music and audio equipment and electronics like brass band items, including drums, saxophones, trombones and cornets, top speakers, bass beams, amplifiers, digital mixers, guitars, flat TV screens, keyboards, domestic lights and stage lights, cord and cordless microphones, studio monitors, sound cards, and all recording studio equipment. For deliveries and orders from abroad, call Pastor Pasteri on 0752 008 443 or 0782 008 443. Pastor Pasteri Music Center.
Oyagala byofumba bijje mangu nga tofunye buzibu bwa mukka kosa bulamu bwo. Weekwate mobile stoves tukukolera ebyoto ebikekkereza enku wamu n'amanda omuli ebyoto bya sola ebikozesa volcanic stones wamu n'olusennyente nga tukolera ne biogas okuva mu busa saako oven gattako sauna erigwa owawaka naawe wa bizinensi ku bbeeyi etakubya ntunnunsi. Kati naba amasomero, amalwaliro, awaka, amakanisa, factories, hotels wamu ne restauranti mutuyite tubazimbire ebyoto bino kuba 0789 47 08 96 ne 0750 82 3 oba jangu ku offices zaffe Namugongo, Kyali Wajara Road opposite ne Dawson Petrol Station esangibwa kulidde ekireka.
Mungude TV, lighting your soul.
Once again, you are most welcome from a short quick break. I hope you've done a little exercise, you've taken some water, and of course you are ready here once again to talk about diabetes and creating more awareness so that you know when you should go and know what your blood sugar levels are like. So of course I'm still having Dr. Susan Nachireka, and of course we are still talking about diabetes. But before, I want to encourage you to start calling in because we have a few minutes from now to close of this program. But of course we would want you to be here with us and interact with our consultant diabetologist from Mengo Hospital. Dr. Susan, we are talking about complications now. For the persons who are living with diabetes, what should they pay attention to, and why should they pay attention to their drugs and treatment?
Yes, so complications of diabetes, if someone has lived with diabetes for more than 5 years, they are likely to get complications, especially if their blood pressure, blood sugars are not well controlled. And that is a common occurrence in our setting. People are not managing their blood sugars very well. So this high blood sugar, we said, damages the blood vessels of the organs, important organs in the body. And so people end up with complications, and especially those who also have high blood pressure, those who have high cholesterol levels, those who are smoking, those who are taking alcohol. So those are people who are likely to have complications of diabetes.
Okay.
And so the complications that we see, we have what we call the acute ones, where, for example, someone can go into coma because of very high blood sugars, or someone can go into coma because of very low sugars. But the chronic complications are the ones which are bringing disabilities and death more commonly than the acute complications. And the ones that we really see and we are trying to encourage screening for include damage to the eyes. Many of our patients end up in the eye clinic, for example, Mengo Hospital, with what we call diabetic retinopathy. So the eyes are damaged, and people eventually become blind because of diabetes. Okay. And yet, this is preventable if it is seen early, because there are treatments that can be given to prevent progression to blindness. We have what we call chronic kidney disease and chronic kidney failure, which is the leading cause of kidney failure, diabetes, among the patients who are attending the dialysis units. Dialysis is when people are going through a machine that washes the kidneys, a work that should be done naturally by your kidneys. So the kidneys can fail, and once they reach that end of failure, then there's nothing you can do. You need to either go on dialysis or you need a kidney transplant. And this can be prevented if you manage your blood sugars well, and also if you get the right treatments to prevent kidney failure. Another complication is heart attack, what we call cardiovascular disease. Now we are seeing heart attacks, very common in our patients.
Doctor, so you can use the screen.
So for example, if you see the heart attack, Brian. Now a heart attack is when the blood vessel is full of cholesterol or fat, and the lumen, the opening of this vessel is blocked with fat.
So blood cannot move.
So blood is not going to move to feed the heart muscle, and yet we know that the heart is a pump. So if your heart is not pumping blood to the body, to the rest of your body, then you can't live. So if it happens and it's big, then people suddenly drop dead. You can also have a stroke. Stroke also happens when the blood vessel within the brain is blocked and it's not taking blood to that part of the brain. And the brain has different functions. So you can find that there's cut-off of blood to a certain part of the brain, and so the limbs may not be able to move, they may not be able to speak, and some people may drop and die. So all these things are happening in someone who is diabetic for a long period of time, and they are not well controlled. Another complication is diabetic foot. Now, patients suffer complications of amputations of these feet that are not managed well. They go through depression. Many of the patients are suffering depression because of foot amputations. Some of these patients face stigma. They end up isolating themselves. They cannot believe they'll go back into the world without a limb. Yes. So, and yet this can be prevented if you manage your blood sugars well, but also if you screen this foot routinely. We encourage to screen this foot routinely to prevent foot complications. So these are complications that we see in our patients that we need to prevent. So we diagnose diabetes.
How do we diagnose diabetes?
How do we diagnose
How
diabetes?
How do we come to a conclusion that you have?
So diagnosis of diabetes is the most simple thing. You just need 5 minutes and you have a diagnosis. As simple as that. Yes, 5 minutes and you have a diagnosis. And yet, people spend years and they have not had a diagnosis. So it is something that is very simple. We are actually teaching people to even do tests at home. We have been advocating that the prices of these testing kits reduce.
The machines.
The machines. Yes. We have had trainings to to the lowest level health workers, the VHTs. VHTs are the lowest level health workers who are given glucometers, these testing machines, to go into the community and screen people. Now, when they screen people, they are supposed to send them to the health facilities to confirm and start treatment. So testing is very easy. There is no excuse not to test someone for diabetes completely. And
away from testing,
yes.
what are other key diagnostic signs and symptoms?
So signs and symptoms also exist. Now, for signs and symptoms, 50% we need to remember don't have signs and symptoms.
Okay.
Yes. So they are there. They tell you, doctor, I have never had anything like this. I've been okay. I'm doing my work. I have no problem. And that's why we are saying don't wait for signs and symptoms, because actually some of the patients, they already have had diabetes for 10 years without signs and symptoms, and they end up with complications. That's why they're coming to hospital. So, but if signs and symptoms are present, people will present with excessive thirst. They present with increased urination, so they are urinating all the time, they are drinking all the time, and they have a high appetite. They are eating. Yes, they feel like every time they want to eat, and yet they continue to lose weight. So you eat, but you lose weight. You're losing weight, and you're eating, and you're sickly. You're getting infections, UTIs, skin infections, you have pneumonias, you have tuberculosis. You're always sickly most of the times. And then there are those pins and needles in the feet. So you find that there's burning in the feet, hotness in the feet. Sometimes you've lost sensation. Others can present with poor vision. For the men, we see that they can present with erectile dysfunction. So they are not able to function as a man as they should. And that is one of the things that will end up bringing them to hospital. So we don't want people to wait for signs and symptoms. We want people to screen early so that treatment can be initiated early. Now, perfect. I know you want me to talk about treatment.
No, before you talk about treatment, have men who are suffering actually that very much problem, and yes. They've been asking, are there possible treatments for specific symptom like erectile dysfunction? But before we run there, I want to encourage our viewers to start calling. Call right now, and we want to receive only like 3 calls, and then we shall see the way forward of this very program. But we want to thank you for watching Google Day Television. Just like I want to encourage you to visit our social media handles, our YouTube, Facebook and Twitter. You follow, you like, and put on your comment, your suggestion, opinion regarding the Diabetes Awareness Month, or what you would want Google Day Television talk about in this very month. I am still having Dr. Susan Nachireka, and we've talked about the key signs and symptoms, but however 50% of the patients may not present with either of the symptoms, but rather present with complications. So Dr. Sue, you want to tell us about this the treatment modalities that are available, but before we run for treatment, just to give a highlight of, okay, maybe we shall talk about it on living with diabetes.
Okay, the challenges. Yes, I also can talk about
let's begin with the challenges.
Yes, so challenges of diabetes is a big to the individuals, to the communities, to the households, to the healthcare system. All these are burdened by diabetes because it is very costly to treat diabetes. The medicines are expensive, and yet they are not available. They are not accessible to the patients in the health facilities. That is known. And even government knows that the treatments are not available, because of the small health budget. And of course, they managed to compare the health budget for diabetes in the US with Africa, and we are very small there. It's like a drop, a drop in an ocean. Yes, for diabetes, and yet the cost is the same. If you're in Africa, in Europe, you're in US, what you spend on diabetes is the same if you're in here and also out there. So people suffer not being able to access medicines. They are not able to access treatments, diagnosis, and all those other things that are involved in managing patients. And those who manage to spend money, they use up all the money they have. Imagine someone has an amputation, they are not able to continue working. Someone has a kidney failure, they need to be on dialysis, and this is the head of a family. So they suffer not being able to continue performing their duties as heads of families and being able to provide for the family. So this pushes families into poverty. And the communities still believe of witchcraft. People are still thinking of witchcraft. In one of the studies, they managed to see what is happening, the diagnostic pathway of patients who eventually come to hospital. They found that patients have symptoms. They go to herbalist number 1, traditional healer number 2, number 3, number 4, looking for a certain treatment modality. And meanwhile, in this time, they are using up all their savings because there is no mercy in those places. They tell you, bring this much. Bring 1 million. Bring 1 million. You use it up. You're going to get cured. Yes, you sell your everything, you see. So by the time they come to hospital, they don't have a coin.
They have just actually come to test what is also here, because we've been all over the treatment areas and we've not been healed.
And this is what we see.
So they just come to pass around.
Yes, they've been, and we see this daily, unfortunately. So the costs of diabetes are big, are very big.
And the herbalists are scooping good money from these
non-communicable diseases. They are scooping money. And of course, it is very difficult to regulate these people because somehow there are challenges. I won't even talk about.
A lot is happening
there. Yes. Now, when we talk about treatment of diabetes, treatment is not only drugs. That's where people really mistake us. Of course, before that, I had not mentioned that health workers had previously not been able to manage diabetes very well also. So you go to a health facility, the health worker has no clue what to do, what to give, which drugs to give. And that is why we have really focused on training health workers to manage diabetes, basic diabetes care, so that even when you're in the most rural place, you can receive someone who is going to treat you and then refer you depending on
how you are presenting that very time.
Yeah, so treatment modalities, not only drugs. We have what we call needs. N is for nutrition. Nutrition plays a big role in managing patients, and that's why we need the nutritionists on board in managing our patients. We have education. We have to educate our patients about diabetes. We have to educate them to understand that this is a chronic illness that they need to put time into to be able to live healthy. We need to encourage exercise, physical activity.
E number 3.
Yes, E number 3 is exercise. So physical activity is very important. It actually helps people to manage control their blood sugars very well. Then the D is the drugs, and that's where the drugs come in.
Imagine drugs are number 4.
Yes, drugs are number 4. So it is not only about drugs. So drugs are number 4, and we've said we have different categories of drugs. We have the injectables, we have the tablets, depending on the kind of patient. And then S is self-care. So self-care, how you take care of yourself, your mental self, your financial self, and all those things are important in making sure this person achieves good diabetes control. And finally, the other S is self-monitoring of blood sugar. Now, that is where we are also seeing a big challenge. People go to clinics, they measure their blood sugar once, and they spend 3 months without checking the blood sugar again.
That's dangerous.
You know? So they come back and they are reporting a figure, one figure of blood sugar, which really doesn't mean anything. And so we are really encouraging people to get themselves the testing machines to monitor, to keep monitor.
Even it becomes convenient.
Yes, it is convenient. It helps you to see how you're doing. It even helps you to know when to run to your health worker than to just sit there and then you wait when things have gone bad. So self-monitoring of blood sugar is an important component of diabetes care.
Wow, thank you so much, Dr. Susan. Now, as we're nearing to the close of this very World Diabetes Awareness Month program here at Health and Beauty program on Google Data Vision, would want you to give us the key summary take-home points in the next 1 minute, and then we make a conclusion of this very program.
Yes, so we are really pleased to speak about diabetes and continue to speak about diabetes, because we know that all of us are at risk of diabetes. All of us are at risk of diabetes, and so we want everyone to interest themselves on how to prevent diabetes. We want everybody to go and screen for diabetes. We want everybody to participate in supporting the diabetes prevention. Prevention, because we don't want to lose people prematurely because of diabetes. So join us this month to make sure that you screen for diabetes, to support people living with diabetes. The children, for example, the children need support. These are young people. They are really growing and they find themselves with a chronic illness. They need to be supported, with psychosocial support, but also to support them with medicines and food and all those things. So be part of the support, be part of the care, so that we can beat this diabetes in Uganda.
Thank you so much, Dr. Susan, for joining us on Google Data Vision. Do you have any regards to your family?
Of course, I know my family has been my support. Today I've been really there, and my children are all over the place, excited watching Mommy on TV. So I send them my regards, my children and my husband, my mom, and my entire family. I send them regards, and of course my colleagues in the diabetes fraternity. Thank you for the work you're doing for Uganda.
Thank you so much, Dr. Susan. Now, of course, before we leave this program, I want to remind you of the next activities. That on 14th is a World Celebration of the Diabetes that will be in Kabale District, and 17th will be World Prematurity Day. But also don't forget the same very 13th is World, it is the AIDS Symposium, and of course different activities, just like I told you, they'll be happening around. And from 18th, actually 22nd, to be Healthcare Partners meeting at Mbale Resort Hotel. Just like the Ministry of Health has very many events, would want to interest you in such events so that you can come on board and take part of these. I want to thank you, Dr. Susan, for coming on board, teaching us about diabetes and how we can go about this. I want to invite you to watch this program once again on Tuesday 3 to 4 p.m. to be a repeated show, but of course it is the same program that will tell you of what has transpired this very Wednesday 10 p.m. I am Kamara Daniel. I hope to see you again and again and again. I love you so much. See you.
TV, lighting your soul.